Hi, I'm Michelle, and today I'm going to take you through a little routine of exercises to help you improve the stability of your pelvis and your pelvic joints if you're pregnant and suffering from pelvic pain. Now, this is a really simple routine. You can do it either lying on the ground, or you can also do it lying on your bed, and the other exercise is lying on your bed or sitting on the edge of your bed if you're having trouble lying down. The exercises are gentle, so they shouldn't aggravate your pelvis at all. If anything feels uncomfortable, stop the exercise straight away. All you'll need is a couple of pillows. I've got some pillows here, and I've also got a belt. So if you've got a belt with a buckle, that would be great too. We'll be using those for some of our resistance strength exercises too. Just before we start, if you've got pelvic pain, you'll know that you've got pelvic pain because it normally presents in the buttocks, either one buttock or both buttocks, about that region there. But it can also go down to the crease of your bottom, up to the crest here, and sometimes it can even extend down to the back of the thigh. It can also present as pain in the, behind your pubic bone at the front as well. And these are the joints here in the pelvis if you look closely, and they become unstable with pregnancy. So these exercises are going to stretch some of these muscles and strengthen the muscles that hold the pelvis together. So let's get started. All right, now wherever you are in sitting, I want you to sit nice and tall, bring your feet apart and your hands onto your thighs. Lift your chest, and we're going to take a big breath in and bring your chest forward and down, and we're just going slowly, just to the point of where you feel some stretch in your back. Bring your chin down, and now just lift and roll slowly. Shoulders are forward, up, back and around. And I'll repeat that again from the side so you can see me from the side what I'm doing. So again, nice and tall, breathing in and coming forward and down. So if you're at home sitting, you might be sitting in a firm dining chair, probably not on the lounge, because the lounge is a low chair usually, and that will aggravate your pelvis if you've got pelvic pain. One more time, and coming forward and down just slowly, and now breathing out and just coming up and lifting. Shoulders are rolling forward, up, back and down. Now we're going to start with our first stretch into our buttocks. So this is to relieve pain in the buttocks. I'd like you to bring one leg up. So I'm going to start with my left leg, bringing it up and across the other leg. And you can use your hand here, just gently pushing down, and then bring your chest forward, bring baby forward inside your thigh and lean your body forward. So you're not trying to get your shoulders forward, you're actually trying to think about getting your belly forward and try to keep your back straight as you lean forward. You should feel that stretch right into that buttock pretty well where you're feeling that pain. And just try to relax your breathing with that stretch. Okay, let's come back up. And obviously you can take your time with these stretches. You can do them after this session finishes. You can do them whenever you need some relief during the day. Other legs coming up, bringing your chest forward and down. I can feel my right buttocks tight there. I probably need to do a bit more of this stretching. Leaning forward, so getting that stretch into the right buttock. And let's come back up and bring the leg down. Now we're going to start with our strengthening exercises. This is where we're going to start with the belt. So if you take your belt, you're going to do it above your knees and do it up so that it ties just so that your knees are about hip width apart. So you don't want them wide apart and you don't want them in too close. But you can just turn your toes out slightly for this particular exercise to activate your buttocks. Now let's turn the knees out, push against the belt, but don't move. And you'll feel your buttock muscles at the sides here working, and relax down. Okay, once again, stay nice and tall, stay with me, and resist, push out against the belt. So I'm pushing out my knees out and I can feel these muscles working. You can put your hands up here and really feel those muscles activating. And let's relax. We're going to do 3 more of those. Here we go. Pushing for 1, 2, 3, 4, 5 and release just slowly. And again, pressing just gently. 1, 2, 3, 4, 5 and release. So we're really working at these muscles because these muscles hold those joints together, particularly as your baby grows and your body gets heavier. One more time, here we go. Pushing out, 1, 2, 3, 4, 5 and release slowly. And you might like to do another set of those today during the course of the day if you can. All right, we're going to unbuckle that now, and we're going to move down into kneeling. So if you're going onto the bed, you can go onto a firm bed if you like to for our kneeling exercises. Otherwise, come with me and I'll join you on the ground. All right, so moving onto the ground now, or onto your bed, keeping your weight even between your knees, coming down, hands on the surface of the bed, and let's just slide back and stretch into the back. Obviously your knees are apart if you're probably in the second and third trimester there, just to give your baby room to come down. And just come down gently, stretching into your back. You'll feel the stretch across the back and across your bottom. Now you don't need to come down as far as I've come down here. Just keep it relaxed and just release. And one more time, breathing in. Let's breathe out and slide back. Just take it down slowly, just to where it feels comfortable for your body. And again, this is another way of getting a really nice stretch through that area there that gets really tight. So the muscles tend to spasm over the top of the joint, and that's to protect and try and hold the joint together, but we want the muscles to work appropriately, not to spasm, which is why we're doing some stretches. Okay, and let's come back up. And you probably know this exercise. It's a really nice way of just loosening up our back as well before we get into the strengthening. Rounding up. And breathe out. And just come back down to flat. Don't hyperextend like that at the moment. Your back's doing that with pregnancy anyway, so we don't want to do that too much. Round it up. And come back, and that should feel really nice to do. Now, moving into our strengthening, if you've got carpal tunnel problems or problems with your wrists, nice to get a little face cloth, roll it up and put it under your hands, and it allows you then to rest on your wrists more comfortably than in that position like that. So if you feel more comfortable in that position with the fists down, you can do so. I'll do that with one hand. All right, so in this position now, I want you to have your normal inward curve in your back. Your hands are underneath your shoulders and your elbows are just slightly bent, not rigid and locked like that. I want you to lower baby down, particularly the lower part of your tummy, and lower your tummy down, really let bub release. Now feel that release there, keeping the normal inward curve in your back. Now gently, this part here, I want you just to draw this in a little bit. Hold that on and keep breathing. So it's just a really, really gentle contraction here. It's not forceful. Keep breathing, keep holding, and relax down. Now I hope you could feel that at home. That's your abdominal corset muscles here that support your back and your pelvis starting to work. So let's go again, drawing inwards, hold it there, and keep breathing. Elbows are soft, chin's tucked. Keep breathing and holding. A couple more breaths there, and relax down slowly. And we've got one more to go here, so just gently lifting bub up towards your back. Here we go. Lifting up and hold. It's the holding and breathing part that's hard, isn't it? See how you go. See if you can stay with me with that. Hold and breathe. Hold and breathe. One more breath. Hold and breathe. And now relax your tummy down. And you might like to just stretch back gently after doing that. Just give your back a breather. Now, we're going to just progress that a little bit and make it a little bit more challenging if you'd like to. Otherwise, you can stay with the same exercise that we just started. So we're coming back up again. I'll just move my pillow out a little bit. Now, when your pelvis is unstable, you don't want to do leg lifting exercises because they're going to shear that joint and make it worse. What we can do to progress the exercise is to do an arm raise exercise. So then you just go a little bit further. So we're going to actually bring the tummy in a little bit, so engage your lower abdominal muscles the way I've been showing you, just drawing that little bit in there. And now with one arm and your palm facing down, I want you to lift that arm up and lower it down, but all the while keeping your abdominal muscles contracted. I've still got that too close, haven't I? I'm going to move it right out of the way. Here we go. So let's go. Tummy muscles are on gently. Elbows are soft. Let's lift up. 2, 3, 4, and back. 2, 3, 4, and release. How did you go with that at home? Not as easy as it looks, is it? Here we go again. Tummy muscles are on. Draw in gently. Let's lift and reach. 1, 2, 3, 4, and down. 2, 3, 4, and have a rest. Okay, let's move to the other side. Here we go. Tummy muscles are on. Let's lift and reach. 1, 2, 3, 4, and back. 2, 3, 4, and have a rest. Try and stay with me for the last one if you can. Ready, and go. Lift 1, 2, 3, 4, and back. 2, 3, 4, and once again rest. And now you might like to slide back again, just taking it slowly, sliding back, feeling that lovely stretch in your bottom. You can come down onto your elbows if you like. You can even bring your head right down if you're able to. And just relaxing your breathing for a moment. Nice big breath into the back and out. And once more breathing in and out. So we're going to now move right down into lying down. You can use a pillow here. Actually, you can use a couple of pillows if you like to. I'm going to come onto my side facing you. I've got a pillow for my head. If you need to, you can use a pillow between your legs or underneath baby as well. So you could use a pillow in that position too if you need that extra support. I'm going to keep the pillow out so you can see what I'm doing. So I'm coming right down into side lying. And now we're doing some more strengthening on those muscles that hold the pelvis together. Head's down, so body spine's nice and straight. And I'd like you just to lift the top knee directly away from the bottom knee, about that far. So we're going to lift it up, and you can see I could have a tennis ball between the knees there, and lower back down slowly. I'd like you to bring your top hand up and put it here, and I want you to feel underneath there. They're the muscles that we're working. So let's lift up, 2, 3, 4, and down, 2, 3, 4, and release. And I'm hoping you can feel some hardness or some tightness develop under that area. That's what you're thinking about. Let's go again. 1, 2, 3, 4, and back. 2, 3, 4, and rest. Let's keep going. Go again. 1, 2, 3, 4, and back. 2, 3, 4, and rest. If your pelvis is really unstable, you might feel that coming higher makes it uncomfortable. Just lift it a little bit in that case. 1, 2, 3, 4, and back. 2, 3, 4, and have a rest. Let's now do the same thing on the other side. Now, remembering that when you roll, when you've got pelvic pain, you want to keep your knees together, and you might find it much easier to roll with a pillow between your legs. So you'd roll like this, coming across, and onto the other side, rolling your body like a log. But I'm going to turn up the other way to face you. So can you roll over at home? I'll turn around here. And we're going to continue with the other side. So, top knee above the bottom knee, directly above, and it stays there throughout. And we're doing our little lift. 2, 3, 4, and back. 2, 3, 4, and rest. And you'll notice my feet stay together the whole time. My knee doesn't come too high. You can often see this done like that. That's just rotating the back. It's not exercising the hip the way we want to do it. Let's go again. So hand up here. Lift, squeeze for this side. 3, 4, and back. 2, 3, 4, and rest. Let's do 2 more of those. Let's go lift. 2, 3, 4, and back. 2, 3, 4, and rest. Now here's our last one. Lift, 2, 3, 4, and back. 2, 3, 4, and take a breather. Now we're going to finish off with some bridges lying on our backs. So you can do these if you're less than 16 weeks without being elevated. If you're over 16 weeks, these exercises can make you a little bit dizzy. So it's a good idea to actually have your upper body elevated, and I'll show you what you can do. So I've got a roller here. You could use 2 pillows underneath your shoulders just to lift your body higher. And the exercise is our classic bridging exercise, and you probably already know this. This is our bridge. Lifting up, using your bottom muscles, and lowering down slowly. But if you have your shoulders elevated, perhaps with a couple of pillows, if you need to, if you're in those later stages of pregnancy, or if you've got a bed where the bed head raises, even better, and you'll find that raises you up and doesn't make you feel quite so dizzy. Now turn your toes out for this exercise and take your knees apart. That way you're going to better activate these muscles. So I've got my hands down for starters. Keep the inward curve in your back, breathing in here, and let's breathe out and lift just to where it feels comfortable for you. 2, 3, 4, and back down slowly, and have a breather. And once again, if your back's sore, you might find that you can just get your bottom off the ground. So go to the height that feels comfortable for you. Push through your heels, ready, and go. 2, 3, 4, and back. 2, 3, 4, and down. Really notice your bottom muscles working here. We really want to train those bottom muscles to switch on. Lift up. 2, 3, 4, and back. 2, 3, 4, and have a rest. Let's do 2 more at home. And if you're not sure whether your bottom muscles are working, put your hands there and feel it. So these are for your big glute max muscles. 2, 3, 4, the big buttock muscles. 3, 4, and back. 2, 3, 4, and have a breather. That was interesting counting on that one. And here's our last one. Ready, and go. Lift. 2, 3, 4, and back. 2, 3, 4, and have a rest. All right, let's finish off coming onto our side with your sore side uppermost. And try to remember that when you're sleeping, keep your sore side uppermost. You might also then like to put your pillow between your legs so that you're comfortably supported, bringing your head right down. Now, in this position, we're going to finish off with just a couple of pelvic floor exercises. If you're not fully familiar with the technique, you can check my video above on pelvic floor exercises during pregnancy. But what we're going to essentially be doing is lifting and squeezing through the pelvic openings. So I'm going to get you to squeeze through your pelvic openings. So squeeze through the back passage, middle and the front, as well as lift inside, because these muscles also support your pelvis. All right, here we go. Ready, and where you are, lift and squeeze. 1, 2, 3. Keep lifting if you can. 4, 5. Keep lifting. 6. Relax down slowly. And depending on where you are in your pregnancy and how strong your pelvic floor muscles are, will determine how long you can actually hold your muscles for. So we're trying to get up to 8 to 10 seconds if we can. So that's what you're aiming for at home. Let's go again. Squeeze the openings closed and then lift inside. Lift. 2, 3, 4. Let's go to the count to 8 if we can. 5, 6, 7, 8. Relax it down slowly. And we'll do 1 more of those, just as a cue for training for you to practice later on today. 1 more time, squeezing the muscles, lifting inside, go, lift. 1, 2, 3, 4, 5, 6, keep lifting. 7, 8, relax down slowly and rest completely. All right, let's just take a moment here. You might like to close your eyes down. Allow your body to relax, feel your bottom relax. Take a few deep breaths right into your tummy. So breathe into your rib cage, into your belly. Big breath in. And let the air out slowly. And again, big breath in. And let the air out slowly. And just take a moment here. So I really hope this little exercise routine helps you in managing your pelvic pain. If you want all my exercise videos together, you can get them in my free pelvic app at pelvic.app. You can see the link below. And also to remembering that you can do this routine every day, or you can do it twice a day during your pregnancy. So thanks so much for watching today. Look forward to seeing you next time. Bye for now.